Hello, Ken Comfort here for Tallgrass Economics. Today on our podcast, we have a return guest that we're very pleased to have back with us. It's Charlene Harrington, who is a gerontologist and a sociology professor at the University of California, San Francisco since 1980. Charlene, I'm going to remind you, is a member of the Technical Advisory Committee for the Medicare Nursing Home Compare website. She's had several instances of testifying before Congress for long-term care issues and policy. She's the author of more than 250 books and articles in her field. And she also is a member of an international study group that exchanges information about senior care around the world in different countries. And that's going to be the topic of our conversation today with Charlene. We're going to learn about how this is managed in other countries and how it compares to what we're doing here in the United States and see what we can learn from it. So with that preliminary information, please welcome Charlene Harrington to our podcast today. Hello, Charlene. Welcome back to the Tallgrass Economics podcast. It's great to see you again.
Thank you for inviting me.
Our pleasure. Last time we had a very good discussion about the long-term care industry in general and your experiences with it and your past history in that world. And it was mentioned that you have been involved with international contacts where you engage with people in other countries in the same area. And that really intrigued us at Tallgrass Economics. And we would like to learn more about some examples of how this is done and in other countries and how it might compare to us and what we can learn from it and so forth. So I would like you to just go ahead and introduce us to a particular country if you want to, and start telling us what your perspectives are on that.
Okay, well, thank you. Well, I thought I would kind of summarize what happened during the COVID pandemic with nursing homes in the United States.
Right.
And then talk about how things are done differently in Norway, because I've been involved with a research study of international countries for 10 years. And all the 6 countries that we studied in depth, Norway is really a star. And it's quite a contrast with the US. So I think people don't realize how devastating the pandemic was for nursing home residents. We've had lots of statistics, but there's a new study that just recently came out by the Office of the Inspector General. And what they found was that during the pandemic, there were 3.1 million people in nursing homes, and 1.3 million of the residents got COVID infections. So it's much higher than we thought. And I think the death rate is much higher than what was previously reported. So we know that there were at least 170,000 deaths just of Medicare patients alone in nursing homes. And I think it's so staggering that it's causing everybody to say what went wrong and what should we be doing. And kind of rethinking the whole idea of nursing home care. I mean, should we even have nursing home care? So some of the key reasons that have come out in the research that why we had so many infections and deaths is that we had totally inadequate staffing in the nursing homes to begin with, especially inadequate numbers of RN staff and nursing assistants. We also had inadequate testing and oversight by the government, inadequate PPE, and we saw that for-profit nursing homes were much more likely to have the infections and deaths. They had higher death rates. And we also found that the design features of nursing homes had a lot to do with spreading the infection. And so I thought I would just walk through some of the problems with the environment and the design.
Excellent. That would be very, very helpful and very informative. Please do.
Okay. So one of the first things we found, in addition to the inadequate staffing, was that the large for-profit nursing homes were the most likely to get the COVID. And many of the nursing homes in the US, well, the average size is over 100 beds. And some of them are very large. And those are the nursing homes that were the most likely to have outbreaks and deaths. So small nursing homes did much better during the pandemic. And the other factor was that the rooms in most nursing homes are very crowded. You have 2 to 4 people in each room, and they're sharing bathrooms as well as dining rooms and so on.
Huh.
So that they didn't have private rooms. Very few have private rooms. And we know that private rooms and private bathrooms are key to preventing infections and preventing the spread. So once the infection got in the home, it was very hard to stop it, going through the entire home. And nursing homes in the United States are very old and outdated. Many of them are 40 to 50 years old, and they're in high rises or large institutional type buildings that look more like a hospital. They certainly don't look like a nursing home. I mean, a home.
Mm-hmm.
And these nursing homes also, lots of them don't meet the fire, the life safety, and the earthquake standards. And they have poor ventilation systems. And so that made the situation much, much worse. So I think it made us conclude that we really need to redesign nursing homes in the United States. It's just not acceptable that these buildings and the way we're having people live in crowded, miserable conditions.
Is the industry or the business receptive to that idea at this time, or is there any resistance to the idea?
Well, the big issue is money, but one of the leading heads of the for-profit Nursing Home Association he has his own nursing home chain, and he's advocating for a move to private rooms and private bathrooms. Most of them are not advocating smaller buildings because the larger buildings, you make more money.
Right.
But we're arguing that we really need to have government set up new standards and really push for small buildings. So that's why I thought I would talk about Norway and because Scandinavia is 20 and 30 years ahead of us. It's shocking because we always think of America, we have the best, and we absolutely do not. In Norway, over 30 years ago, the government made a decision that they would rebuild every nursing home in Norway, every single one. And they required every nursing home to have private rooms and private bathrooms.
Is there a private industry there for this, or is this all government driven?
Well, in Norway, each city or what they call municipality, is responsible for the nursing homes and
Okay.
hospitals in their area.
Okay.
So they're owned by the local government.
Got it.
And the local government can contract out if they want to. They can contract the management of the nursing home to a nonprofit or a for-profit. And in Norway, but only about 6% of the Norwegian nursing homes are contracted out.
Uh-huh.
The rest are owned and operated by the local government. So the difference is they're not trying to make money, but it was a huge investment for the country because they had to raise the money to rebuild the facilities.
Sure.
And they brought in leading architects, and they moved to what we call these smaller, small homes with clustered designs. So the way they're set up, you have maybe 10 or 12 residents that live in a cluster or a home. And some of the cluster, well, some of them are separate buildings, small buildings, but some of them are bigger buildings that each floor has 1 or 2 clusters on it.
Okay.
And each cluster of rooms they have the private room and private bathroom, but they have their own dining room, their own living room, and their own kitchens. So the food is cooked right on the premises.
Okay. Yep.
And the staff stay within that unit, taking care of the residents.
Sure.
So the residents are living with a group of people, so they get to, it's like a family. So they get to know everyone. And it's, what's interesting about it is they have the staff on that unit. You have a registered nurse and nurses that give medications and treatments, but you have the nursing assistants or caregivers, and they not only take care of the patients or residents, but they also do the cooking and the cleaning. So you don't have so many people coming in and out of the units.
Right.
So that is so, but for example, when I went to visit, the first time I went to Norway, I went to a large building that had these different clusters on each floor. And we walked into the living quarters of one, and they had the table was set up for, it was like 10 or 12 residents. This was 9 o'clock in the morning. They had candles lit on the table. Tables were gorgeous with beautiful tablecloths. The dining room and living room was so comfortable and warm. And their residents are quite, a lot of them are quite disabled.
Okay.
But they are able to provide the care in that situation. So it was just very warm and pleasant and quite a different, almost shocking contrast to what a nursing home typically is in the United States.
Well, it would be. Now, I have a question for you in that regard. Have you ever heard of a company in the business here in the United States called Reflection Living?
No.
Okay. Let me quickly tell you who they are. They're based in Wichita, Kansas. They originated there. They were founded by 2 RNs, and it very closely fits the description of what you just said. Now, we know they're unique. They're not a typical model. And they're a small enterprise right now, but they, like, for example, in Wichita, they have a campus of 5 buildings that each can house 12 people. And
Perfect.
it's the way you're describing it. And then in Dodge City, they have one. And so there's about 5 different communities around Kansas where they have one or more of these clusters, as you describe them, that are modeled exactly like what you're talking about. I'm wondering if one of these nurses might have traveled to Norway and learned about this system, because it really fits what you're talking about. I don't see any evidence of it getting traction around the country. And if you haven't heard of them or anything like it, that's probably
Well,
revealing.
we do in the US, we have one model called the greenhouses. And that was developed by Bill Thomas. And it's a friend, I think you would call it a franchise. And they have homes, they have about 300 throughout the country.
All right.
But there's some in Mississippi and some of the southern states. And it's exactly that model. You know,
Okay.
they're small houses built on a campus type situation. And most of them are nonprofit. And they did extremely well during the pandemic. There was a research study and it showed they had very few infections and deaths in contrast to
Sure, boy, it really is.
typical nursing home.
Right. Now, do they, and I don't know this yet about Reflection. In fact, I hope to have the founders on a podcast to talk about their business model and how they've done this. But Mr. Thomas, for example, is his primary funding come from Medicare cover, or is it,
Yes.
okay?
Yes, the residents receive Medicare and Medicaid.
All right, both Medicare and Medicaid.
But it depends. See, they just help with the model. So they are looking for nonprofits or nursing homes that want to develop a greenhouse. And then they will go in and help with all the regulations, with the design and getting it all set up. And you pay a franchise fee to the greenhouses.
Gotcha. Mhm.
But there are other examples around the country. There are architects that specialize now in these small homes.
Sure, that's good.
But most big for-profit companies don't want to do that because they don't think they're going to make enough money off of it, because so it's a better design for nonprofits, I think.
Right. Well, I don't know that Reflection is a nonprofit per se, and so I'm curious about how they are funded. I would love to hear that they're able to operate efficiently off of Medicare level revenues and not extremely high, private pay type sources.
Oh yes, they all of the greenhouses, they're not private pay.
All
I
right.
mean, I think of maybe a few small homes are private pay, but most of them are not.
Okay. What do you know anything about staff compensation? We know that the reputation of the for the large for-profit chains, the compensation is pretty poor commonly, and they like to have a high turnover so that they don't have to elevate pay over time. This model, like Mr. Thomas, do you know anything about what their policy is?
Well, they don't really dictate that. I think it's up to the organization that sets up the nursing home. But we know that in general, the nonprofits have much higher pay rates and more stable staff. And that was another thing that really was helpful during the pandemic.
Would be, yes. Very, very critical. Yeah.
So in Norway, they have very high salaries. A nursing assistant would make about would be an equivalent of about 50,000 a year.
Okay.
And they have all of their health insurance, their vacation time, sick leave. They have extremely good benefits. And that's all paid for by the municipalities.
Yeah. Now, I'm pretty sure, I've looked at statistics on this in a general sense. I'm guessing that Norway's per capita healthcare cost, by population per capita cost, is probably dramatically lower than ours is here anyway.
Yes,
So,
I think it is. I mean, they have this investment, but in the long run, you save money because they own the buildings
uh-huh.
and they're not trying to make a profit. So almost 90% of the money that is allocated for a nursing home goes for the service.
That's,
And whereas here in this country, it's not uncommon that only 35% or 40% is going for the actual nursing care.
yeah. And the rest is going to shareholders.
It's
Yeah,
going to profits and real estate operators and all the related profit companies. So
exactly.
now Norway did have an experiment where they, in Oslo, the municipality decided to bring in a couple of large nursing home chains.
Uh-huh.
And during the time that I was working with them, with our other colleagues, there was a huge scandal. And it turned out that these companies, the way they were making money was they weren't paying the pension benefits and the benefits to the workers.
Yeah.
And they found that out. And so they have kicked most of these for-profit companies out of the management. And they could do that because they owned the buildings. So they just did not renew the contract with them.
Sure.
In this country, we're held hostage to these for-profit companies because they own the property and they own the buildings. And that makes it very difficult to have any leverage over them.
That makes sense. Wow. Okay. So there's a lot to learn here if we want to learn it.
The other thing is they have very good staffing ratios in Norway. They have a high number of RNs and overall staff per resident, much higher than in the United States. And again, it's an investment. And so there was some criticism by some of the researchers of the government. They said, well, we're spending so much money to set up these single rooms and bathrooms and new buildings and all that. And they spend a lot on nursing homes. And the legislators said, well, we are probably going to use those services ourselves. We want it to be nice.
Yeah.
Now, you would never hear a US congressperson or senator ever think that they're going to end up in a nursing home.
That's true.
And want it to be nice.
Well, and that makes a lot of sense. And in that environment, there's just a much broader sense of caring for each other in that area, isn't there, than what we seem to do here.
Exactly.
Yeah.
Yes, I think they have a much, what they call solidarity. They want to protect the people in the community.
Yeah.
And have a different attitude toward older people. I mean, they really respect older people and feel they've worked hard and they deserve to have a good retirement and a good life. And I think we have a very ageist society in the US.
Yes, absolutely. So you probably give a lot of thought to, how do we change this? Where do we go from here? How do we get traction? How do we build is it a grassroots or a groundswell of concern and interest in changing this? Because on the surface, it really looks pretty straightforward and pretty obvious how beneficial this would be. And yet, you have these situations like Mr. Thomas and the folks at Reflection Living who are basically outliers rather than new models.
Yes. Well, I think we have to popularize this. We have to get people talking about it. I mean, there's no reason we should be warehousing people in these horrible environments. And so we have a group of advocates in California, and we've been talking about this for all year. And we had the governor of our state developed a new master plan. And we were able to get this into the master plan that the state wants to develop small nursing home model.
Right, great.
And we actually, in California, the greenhouse people tried almost, I think it's about 8 years ago, to get some small homes set up. And they had the state reduce some of the regulations, because a lot of the regulations do not allow for these small homes. And so that was a big effort, but it never really went anywhere, because the state regulations were still too restrictive and didn't accommodate, having a kitchen and having a house type model, where you had the kitchen and living room and dining room all together. And there's also problems with the fire marshals. There's all kinds of regulations that need to be changed. And so in California, the governor's offices asked these different departments that are related to nursing homes to get together to see what they can do to try to improve the regulations and formalize this model. In California and many states, we have a state loan program for nursing homes and residential care. I don't know about Kansas, but I know at least half of the states have it.
Okay.
And what we'd like to see is those loan programs revised so that they focus on small homes and on nonprofits, because the for-profit companies have plenty of money for capital. They can finance new buildings if they want on their own. You don't really need the state to subsidize them to do that. And some of these big real estate investment trusts, they are like Welltower. They have over $4 billion in revenues each year, and own, hundreds and hundreds of nursing homes.
Right.
So they have plenty of money if they wanted to invest in redoing nursing homes.
So they would need to be incentivized to change their priorities, is really what it sounds like very much.
And pushed by the regulators. So I think we need leadership in Washington. So we're also trying to push for a revision of the HUD loan program. HUD has over $6 billion in nursing home loans, and they're mostly to for-profit companies. And many of these loans are to the worst possible owners. They went to the government for loans because they had trouble getting loans privately.
In the private sector, okay.
And we really feel the whole HUD program needs to be revised so that we're not giving out loans to these for-profit companies, especially ones with bad care and bad reputations. And reorient the HUD money to small home designs and nonprofit or public ownership. And it could be done.
Are you aware of any legislators that are champions of this idea or likely to be supportive of this idea at this time?
Well, I think, with the new administration at HUD, there may be an interest in this.
Okay.
And we're the Senate subcommittee, Senator Wyden is working on a nursing home reform bill, and there's interest in the Ways and Means. And we've been working with the American Bar Association. So Charlie Sabatino, who's a very well-known lawyer, has put together a resolution for the American Bar Association to push small homes this year. And we have a new article that's going to be coming out shortly, which I can send to you once out to try to promote this idea.
Right.
I think we want to get away from the idea that it has to be a greenhouse. A greenhouse is a good model, but there are other small home models that can be done. But we really need leadership at the state level and the federal level, both for the financing and to make sure the regulations are supportive of these models.
Absolutely, and that's encouraging to hear, though, that there's more attention being given to this in the way that you're describing. But you made me think of something a moment ago that suggests that perhaps in this country, the bar has been very low for a long time. And I'll give you an example. Before the privatization or these large corporations came on the scene, I remember the term the county home.
Yes.
Because it was typically, even though that the home might be sitting in the middle of a town, it belonged to or was the responsibility somehow of the county. And they were not very pleasant places. They were scattered all over smaller communities. And if you had occasion to go visit one, it was pretty depressing. So if that's been the standard that we have operated in for a really long time, that gave the private industry a lot of latitude to be pretty low grade, didn't it? Because the expectations maybe were pretty low to start with.
Right. And yes. And then, although some of the, like the city and county of San Francisco owns one of the largest nursing homes in the country. They have 760 beds. And they redesigned the nursing home a few years ago and rebuilt it because it didn't meet the earthquake codes.
Oh. And
the city and county, they have a large campus. They didn't do the proper design, but they do have very good wages and benefits for their workers. And a lot of another example are the VA homes. There's federal VA homes.
All right. Yes.
And state VA homes. And the federal VA homes seem to do well during the pandemic because they have very good staffing and wages and benefits. And some of the state homes that had good leadership did well. Others, especially those that were contracted out to for-profit companies, did very poorly. So I think, there's money that the VA really needs to rethink their nursing home setup. Because they don't have enough beds for everybody in the VA. So they contract out with a lot of for-profit companies.
Oh, okay.
But the VA, to their credit, has really put a lot of money into home care. And I think that, the Biden administration is trying to make a commitment of over $400 billion for home and community-based services. And I think this is a very positive thing because many people do not need to be living in nursing homes. they're forced in there because they don't have adequate housing and they don't have the communities, they don't have support services, they don't have nursing help to come in. So I think we need to rebuild and downsize the nursing homes because we don't need nearly as many nursing homes as we have. If, in fact, I think we could cut them by half or more.
Wow.
And we have seen states that have done that. Oregon is usually used as the prime example of a state that's been able to shift away from nursing homes and develop. They have foster homes and lots of small group homes and home and community-based services. So they really made a commitment to put the money into the community instead of these for-profit companies.
Very good. So they're held up as a standard or a potential standard for how it could be done pretty much everywhere.
Yes.
That's
all around the country.
That's good.
And other states have done well. Minnesota is also usually used as.
Is it? All right. All right.
So I think there's a lot of positive things that may come out of the pandemic if we can just keep pushing and have a vision for where we want to go instead of just saying, let's go back to businesses.
That's so true. Well, it's, and there's so much depressing information about this particular part of American healthcare that it's really good to hear these positive things that you're sharing and the fact that there are some good examples and we do have some direction and know what we need to do. It's just a matter of finding the will, the public will, the general will to do that.
Exactly.
Yeah. That's very encouraging. Well, really appreciate your time here today. We've been going for a while, but you have shared a lot of information, and I assure you, anybody that listens to this better be taking notes because you've covered a lot of ground, and certainly it's been enlightening to me. I've learned a lot here in this conversation today, and I really, really appreciate it.
Well, thank you for having me, and I think this is a good service. If we can get the word out that we can do better. We don't have to continue in the mode we've been operating in.
That's exactly right. And that's exactly why we love having you on as a guest, and we will want to do this more. So we're looking forward to that as well. And of course, we will do everything we can to publish this and distribute it as widely as possible because there's some very valuable information in here, and everybody needs to know this, not just people who are in the business.
Right.
Right. Well, thanks again. And
thank you very much.
Look forward to talking to you in the future.
All right.
Okay. Bye.
Bye.